Welcome back to Therani. I'm Joe B. It's time to introduce the latest in physical therapy in terms of rehabilitating a weak hip and knee. Introducing Blood Flow Restriction Rehab. Let's dive in. For this video, the Delphi personalized tourniquet system will be used to explain the blood flow restriction concepts. According to evidence-based literature regarding muscle strengthening guidelines, true strength and hypertrophy can be attained if you engaged in 8 to 10 upper and lower body exercises targeting major muscle groups. Performed 2 to 3 times a week at 70% of 1 rep max. Unfortunately, this can be difficult to attain for patients coming to your physical therapy clinic since they are in pain even prior to the physical therapy session, are elderly and arthritic. In addition, some patients are post-operative and not allowed to lift weights or has been provided non-weight bearing status by their referring medical doctor. The best way to attain strength for this population is to use blood flow restriction rehabilitation, or BFR. BFR is an application of a specialized blood pressure cuff to partially restrict arterial inflow for short periods of time while performing low-load exercises. BFR increases cellular protein synthesis to increase muscle bulk. It also improves myostatin production for strength enhancement. And finally, it also boosts endorphin production to reduce pain. Here are the precautions for BFR. If you have this, then BFR should be used with caution. Here are the contraindications for BFR. If you have this, then BFR should not be used. For the BFR cuff setup, before putting the BFR cuff, you need to place a soft, non-shedding material or 2 layers of stockinette or a matching limb protector sleeve. This is to prevent rubbing of the cuff against the patient's skin. The limb protector sleeve should extend more proximally and distally than the BFR cuff so as to not irritate the skin. Once the limb protector sleeve is in place, then the BFR cuff is placed over it and tightened by sliding the faceting strap under the application handle. The cuff sizes can vary from a red 18-inch cuff, 24-inch cuff for medium, and 34-inch cuff for large. The port connector should be in line with and facing cranially, and the BFR tubing is attached from there. The other end of it should be attached to the BFR machine. For the machine setup, you can turn it on by pressing the button on the left lower hand side. After that, the machine will inform you that it is doing its own self-test and calibration check before taking you to the main menu. For the main menu, you will select the body icon on the upper left-hand side. This will take you to the personalized tourniquet system. From there, you have to select the ORS to allow the machine to be set to calculating the limb occlusion pressure, or LOP. This will take you back the main menu, wherein you now need to press the personalized tourniquet button, or PTP, on the bottom left side of the main menu. This will inflate the cuff and eventually show you the LOP of 133 millimeters of mercury and PTP of 67 millimeters of mercury to be used while your patient exercises. You then can press the green check mark button on the lower right hand side to agree to the set pressure, and that check mark will also take you back to the main menu. Once on the main menu, you can press the inflate or INFL button on the lower right hand side. This will inflate the BFR cuff and you are ready to exercise. To strengthen your hip and knee extensors, simulate normal daily lower extremity activities like placing the foot in front of your body and allow the exercises to be easily replicated. You can start with a basic hip flexion with knee extension exercise. Position yourself in supine. From there, perform hip flexion and knee extension up to 45 degrees of the range. The first set is done 30 reps with an execution speed of 2 seconds up and 2 seconds down. Once finished, you can rest by pressing the timer in the middle of the main menu. This will give you a 30-second rest. After that, the machine will beep, giving you a go signal to perform the next set, but only 15 reps. Once you finish that, then rest again for 30 seconds, then perform 2 more sets of 15 reps. The BFR rehab can be performed 2 to 3 times a week. Eventually, you can progress it to a closed chain exercise for more challenge, like a forward lunge, with same exercise parameters of 2 seconds to go to as low as able, and 2 seconds to come back to the initial position. Then press the deflate button on the lower aspect of the display. This will deflate the cuff, and you are ready for aftercare of the machine. I am not associated with the Delphi brand. My certification to provide the service are from Owens Recovery Science, but are not a part of their education team, as this video is meant to be a broad strokes video. The specifics of BFR, I urge you to undergo your own certification. If you like this video, please like, share, and comment. And for more therapy animations, please subscribe to Therani.